I'm Brenda Jimenez, and today we'll be doing Skinfold testing. You'll be needing some calipers and a marker. Before we begin, I'll be giving you some tips. Be sure to take all measurements on the right side of the client's body. The client's skin should be dry and lotion-free. Make sure not to take any Skinfold measurement immediately after exercise. By using the marker, we'll be identifying and marking all sides before measuring. Firmly grasp the skin hold between the thumb and the index finger of your left hand. 1 centimeter above the site is to be measured. In order to grab the skin fold, you are going to be placing the thumb and index finger about 3 inches apart on the line that is perpendicular to the long axis of the skin fold. Pulling the skin fold up and away from the body. Make sure you keep the fold elevated while you take the measurement. Keep pinching the fold with your left hand throughout the entire measurement. You'll be holding the caliper in your right hand, with the dial facing up. You'll be placing the jaws of the calipers perpendicular to the fold, 1 centimeter before the fingers and halfway between the crest and the base of the fold. You'll release all pressure on the scissor grip while keeping the caliper perpendicular to the skin fold. Record the skin fold measurement to nearest 0.5 millimeters, 1 to 2 seconds after releasing the scissor grip. You'll be taking the skin fold measurements in rotational order to allow time for the skin to regain its normal thickness. There'll be 7 sites we'll be testing today: the triceps, subscapular, the chest, the mid-axillary, the suprailiac, the abdominal, and the thigh. You'll take a minimum of 3 measurements on each side. If duplicate measurements are not within 1 or 2 millimeters, you'll be needing to retest the site. After 3 measurements are taken on each site, you'll calculate the average for each skinfold site. Using the client's measurements and validate skinfold equations, percentage fat can be estimated. And we will begin. The first site we'll be testing are the triceps. We are doing a vertical fold. It is on the posterior midline of the upper arm, halfway between the acromion and the olecranon process, with the arm held freely to the side of the body. Next, we'll do the subscapular. It will be at a diagonal fold at a 45-degree angle, 1 to 2 centimeters below the inferior angle of the scapula. If you have a hard time seeing or finding the scapula, have the client pull their arm back. It'll make it easy. Once taking the measurements, make sure the client returns their arm at the side. Next, we'll be doing the chest. It is also a diagonal fold. This will vary between men and women. For a man, it will be 1/2 the distance between the anterior axillary line and the nipple. And for women, it will be 1/3 of the distance between the anterior axillary line and the nipple. Next, we'll be doing the mid-axillary. It will be a vertical fold. This is located at the mid-axillary line at the level of the siphon process of the sternum. An alternate method is a horizontal fold, which is taken at the level of the siphosternal portal in the mid-axillary line. Next is a suprailiac. It is also a diagonal fold. This is in the natural angle of the iliac crest, taken in the anterior axillary line immediately superior to the iliac crest. Next, we have the abdominal region. It will be a vertical fold. The abdominal will be taken 2 centimeters to the right side of the umbilicus. Be sure to ask the client to put all their weight on the left side of the body, so they won't have any weight on the right. It is a vertical fold. It is on the interior midline of the thigh, which is midway between the proximal border of the patella and the ingenial crest, which is the hip. The following equations will help you determine the body density for men and for women. Then we have the Brodziak and Suri for body fat percentage.